Irregular periods. What your body is actually trying to tell you when your period is more than just a period. Most women treat irregular periods like an inconvenience. Like, ugh, not now, not again. But here's the thing. Your menstrual cycle is actually one of the most accurate health indicators your body has. Gynecologists call it the fifth vital sign, right up there with pulse, blood pressure, temperature, and breathing. When your cycle goes off track, your body isn't being difficult. It's sending you a signal, loudly and persistently. The real question is, are we actually listening? What's actually normal before we talk about what's wrong? Let's get clear on what's right. A normal cycle looks like this. Length, 21 to 35 days. Duration of your period, 3 to 7 days. Blood loss, roughly 30 to 80 total. Regularity, pretty consistent gaps between cycles. If your cycle consistently fits within these numbers, you're good. If it doesn't, keep reading. Types of irregularities and what they mean. Cycle, shorter than 21 days. Periods coming too often can point to luteal phase deficiency. This is when the second half of your cycle is too short. Your body doesn't have enough time to produce adequate progesterone. And this is actually one of the most common reasons women struggle to conceive. An overactive thyroid. Hyperthyroidism speeds up a lot of processes in your body, including your cycle. Inflammation in the pelvic area. Worth checking out if this is happening consistently. Cycle, longer than 35 days, or no period at all. This is one of the most common things women worry about. Polycystic ovary syndrome, PCOS. The most common reason for irregular cycles in women of reproductive age. With PCOS, ovulation happens rarely or sometimes not at all. Classic signs include weight gain, acne, and excess body hair. Hypothyroidism. An underactive thyroid slows everything down, including your hormonal balance. Your cycle stretches out and periods can disappear altogether. Hyperprolactinemia. This is when prolactin, the hormone responsible for milk production, is elevated. It can suppress ovulation even in women who've never been pregnant. Chronic stress and emotional burnout. Stress raises cortisol. High cortisol suppresses your reproductive hormones. Your brain literally decides now is not a good time for reproduction and shuts it down. Rapid weight loss or not eating enough. When body fat drops too low, your body stops producing enough estrogen. Periods disappear. It's a protective mechanism. Really heavy periods. If you're going through a pad or tampon every hour, that is not normal. Uterine fibroids. Benign growths in the wall of the uterus, one of the main causes of heavy bleeding in women over 30. Endometriosis. Tissue, similar to the uterine lining, grows outside the uterus. Severe pain and heavy flow are the classic signs. Blood clotting disorders. Sometimes heavy periods are actually the first clue that there's a problem with how your blood clots. Estrogen and progesterone imbalance. When estrogen is too high relative to progesterone, the uterine lining builds up more than it should and sheds more heavily. Very light periods. Light flow is also worth paying attention to. Uterine adhesions. Scar tissue inside the uterine cavity that can form after procedures or infections. Declining ovarian function. As we age, or due to various other factors, the ovaries can start working less actively. Hormonal contraceptives. Some types of birth control intentionally reduce flow, and that's completely expected and normal for that method. Severe period pain. A little discomfort on day 1, totally normal. Pain that puts you in bed and ruins your day, not normal. Primary dysmenorrhea. Functional pain with no underlying condition. More common in younger women. Linked to an excess of prostaglandins. Secondary dysmenorrhea. Pain as a symptom of something else. Endometriosis, fibroids, inflammatory conditions. This one needs proper investigation. Lifestyle factors that mess with your cycle, beyond medical conditions. There are everyday things that directly affect how regular your cycle is. Stress. Number 1 on this list without question. Psychological pressure disrupts the hypothalamus, and that's the part of your brain giving instructions to your entire reproductive system. Sudden weight changes, whether gaining or losing. Fat tissue is actually involved in estrogen production. Too little or too much, both throw things off balance. Intense exercise. Female athletes deal with missed periods all the time. When the body is in an energy deficit, it turns off reproductive function to conserve resources. Poor sleep. Your circadian rhythms are deeply connected to your hormonal cycles. Chronic sleep deprivation throws the whole system out of whack. Travel and time zone changes. Even a temporary disruption to your body clock can shift your cycle. When to actually see a doctor. Don't put off seeing a gynecologist if your cycle has been irregular for 3 months or more in a row. You haven't had a period in over 3 months and you're not pregnant. The pain is so bad it interferes with your normal daily life. You're going through period products more than once an hour. You're spotting between periods. You're trying to get pregnant and your cycle is all over the place. What tests you might need? A good doctor will likely order hormone panel, FSH, LH, estradiol, progesterone, prolactin, testosterone, thyroid hormones, TSH, T3, T4, pelvic ultrasound, to check the ovaries and uterus, complete blood count and metabolic panel, if needed, an MRI of the pituitary gland, the bottom line. An irregular period isn't just an inconvenience. It's your body talking to you in the only language it has. And it's worth learning to understand what it's saying. A regular cycle is a sign that your hormonal system, thyroid, adrenal glands, immune system, and nervous system are all working in balance. When something goes wrong, your cycle is usually the first thing to change. So, listen to your body, track your cycle, and don't ignore the signals it's sending you. You deserve to understand what's going on inside. This article is for informational purposes only and is not medical advice. If you're experiencing any irregularities in your cycle, please see a gynecologist.